Chronic phlegm in the throat is one of the most common problems people face. Constant throat clearing, a feeling of congestion, or postnasal drip often bring not only discomfort but also serious issues like chronic coughing. To address this problem effectively, it's essential to understand its root causes and potential solutions. Chronic coughing is one of the primary symptoms of constant phlegm. Coughing is usually a reflexive response of the body to irritants in the airways. When phlegm accumulates in the throat, the body tries to remove it, leading to a persistent cough. The problem arises when the phlegm is present continuously, causing a chronic cough that doesn't subside for a long time. One of the most common causes of chronic phlegm and coughing is gastroesophageal reflux disease, GERD, and its variant, laryngopharyngeal reflux, LPR. GERD occurs when the valve between the esophagus and stomach doesn't function properly and doesn't fully close, allowing stomach contents, including acids, to flow back up into the esophagus. When acid reaches the throat, it irritates and inflames tissues, triggering phlegm production and coughing. In some cases, this process doesn't stop at the esophagus, as acid can travel even higher, reaching the throat and even the vocal cords. This process, known as LPR, differs from GERD in that it can occur even with minimal stomach acid, and symptoms are often felt more in the throat than in the esophagus. Symptoms of GERD and LPR include not only coughing and phlegm, but also chest burning, a sour taste in the mouth, throat irritation, and even hoarseness. With LPR, chronic throat pain, frequent throat clearing, and a sensation of a foreign body in the throat may occur. Long-term acid exposure can damage the mucous membranes, increasing the risk of inflammation and infections. Traditional treatments for GERD and LPR generally focus on reducing stomach acid, which essentially masks symptoms, but doesn't always address the underlying issue. Commonly prescribed medications include antacids or proton pump inhibitors that lower stomach acid levels. However, reducing acidity can have negative consequences, as stomach acid performs several important functions in the body. It not only aids digestion, but also plays a protective role against pathogens entering the stomach with food. Without adequate stomach acid, the digestive process is disrupted, leading to the buildup of undigested food and increased pressure on the valve between the stomach and esophagus. When this valve is weakened, stomach contents begin to flow back up into the esophagus, leading to reflux. An important aspect is the function of the valve between the stomach and esophagus, called the lower esophageal sphincter, LES. Normally, it should be tightly closed to prevent the backflow of food and acid. However, low acidity and muscle weakness can prevent it from closing properly, contributing to the development of GERD and LPR. Therefore, maintaining a normal acidity level rather than suppressing it is essential for preventing these issues. Stomach acid, among other functions, activates enzymes such as pepsin, which breaks down proteins into amino acids. Without adequate acidity, food remains only partially digested, allowing bacteria to thrive in the upper gastrointestinal tract. Consequently, excess bacteria and incomplete protein digestion lead to gas formation and increased pressure in the stomach, once again preventing the valve from closing properly. There are several ways to improve stomach acid production. First, focus on diet and incorporate more protein and healthy fats, which stimulate enzyme and acid production. It's also beneficial to consume foods rich in zinc and B vitamins, as they are involved in stomach acid production. Probiotics and fermented foods help improve digestion, support microbiome balance, and reduce strain on the stomach. Intermittent fasting is another way to promote stomach acid production. By observing certain breaks between meals, the body self-regulates, including by increasing acidity in preparation for the next meal. This helps reduce food stagnation and alleviates pressure on the valve, preventing acid backflow. Additionally, avoiding habits that worsen the condition is important. This includes limiting the excessive consumption of alcohol, coffee, spicy, and fatty foods, as they relax the esophageal sphincter. It's also best to avoid lying down immediately after eating, waiting at least 2 to 3 hours to allow food to pass from the stomach to the intestines without putting pressure on the valve. Maintaining an adequate level of stomach acid is crucial in preventing chronic phlegm and coughing. Reducing or stopping acid-suppressing medications can be challenging, but in the long run, it allows for improved digestion and a decreased risk of chronic reflux and related problems. Proper diet, supplements, and routine changes can help maintain acidity and ensure proper body function. If chronic phlegm in the throat persists, it's worth considering a stomach acidity test and discussing ways to maintain it with your healthcare provider. This may be the first step to eliminating chronic coughing and improving overall health. Thank you for watching the video until the end. I invite you to subscribe to my private Telegram channel where all exclusive videos on health and longevity are available. Link in the description.